Hello, I'm Dr. David Cathcart. I'm a family practice physician from Heartland Regional Medical Center in St. Joseph, Missouri, and I'm here today to talk to you about cerebral palsy. Cerebral palsy is a disorder that affects the brain, particularly the motor movements of the brain, and is caused by damage to the brain, usually or frequently at birth, sometimes before birth, and sometimes shortly after birth. The causes of cerebral palsy are not fully understood, but they either are a result of lack of oxygen. I'm talking about lack of oxygen at birth. It's probably one of the least likely reasons, probably accounting for less than 10% of the people that have cerebral palsy, to something else, such as infections, that can cause damage to certain portions of the developing brain. Ultimately, what you have with cerebral palsy then is a damaged brain that damages the motor movement. So people have various difficulties with motor movements. And when I say motor movements, I'm talking about the ability to use your arms or your legs or to be able to speak. So you can have all sorts of problems, either with sitting up because you can't hold yourself up. You could have problems with the use of your hands. Particularly common is a difficulty with coordination or the ability to control fine motor movements with your hands or with your legs. People that have cerebral palsy tend to have, that are able to walk, tend to have what's called a scissor walk. It's a very characteristic kind of walk where you see them walk almost as like a marionette, like their legs are crossing over each other as they walk. So cerebral palsy then can cause problems with activities of daily living, feeding yourself, troubles in ambulating, getting around. You may need a wheelchair, or you may need a scooter or something. You may have trouble speaking. You may have trouble communicating completely altogether, and you may need some help with some communication devices. One of the things that I've noticed in the patients that I've seen with cerebral palsy is the far majority of them, their intellect is perfectly fine. But because of the way they come off and present themselves, because they have trouble with coordination, we tend to think of them as retarded, when in fact only 30% or less of the people that have cerebral palsy have any degree of mental retardation, and perhaps it's even less than that. So we need to be very careful when we're talking with people that have cerebral palsy, not to assume that they're retarded, or not to assume that their intellect is deficient. So in summary, there are multiple kinds of problems that someone can have that is living with cerebral palsy, mostly motor disorders, with respect to communication, with respect to coordination, with respect to ambulation, and then perceptions that we may have about those with cerebral palsy, particularly with respect to intellect. This is Dr. Cathcart talking about living with cerebral palsy.